In this video, we are going to discuss about the knee joint. We are discussing the third part of this video regarding the knee joint. So we will continue with the bursae around the knee joint and we'll discuss the relations of the knee joint here. So first we shall discuss the bursae around the knee joint. So first we are discussing about the anterior group of bursae. So the bursae which is related anteriorly to the knee joint. So I have drawn a diagram here. You can see the lower end of the femur here. This is the upper end of the tibia, that is the tibial condyle, and the patella. These are the bones taking part in articulation around to form the knee joint here. So we'll discuss the anterior group of bursae. You know that inserted into the upper part of this patella, so this is the patella. Inserted into the upper part of the patella, there is a quadriceps tendon here. So this is the quadriceps tendon here, and this one, that is known as extension, is known as the ligamentum patellae, which is attached to the tibial tuberosity like this. So this one was the quadriceps tendon. So keeping this in mind, we can discuss the superficial bursae. These are the anterior bursae. So this bursae related to the patella. So you'll see the superficial bursae first. And in front of the patella, that is between the patella and the skin, you have a bursae which is known as the prepatellar bursae. So if you see the outline of the skin here, this is the skin. Between the patella and the skin, there is a subcutaneous bursae here. So this bursae is known as the prepatellar bursae. So this is the prepatellar bursae. So we have another subcutaneous bursae here, which is related to the patella. So this one is located below the patella but in the subcutaneous plane. So that is located below the patella. So it is known as the infrapatellar. As it is located in the superficial part, this is known as subcutaneous. It is present in the subcutaneous plane below the patella. So it is known as subcutaneous infrapatellar bursae. So this one, which is present between the ligamentum patellae and the skin in the subcutaneous plane below the patella, is known as the subcutaneous infrapatellar bursae. So which are the anterior bursae which are subcutaneously present? This is the prepatellar bursae, which is present in front of the patella. Another one is the subcutaneous infrapatellar bursae, which is present below the patella. Now we'll look at the deep bursae, which is related to the patella. So this includes a bursae which is located above the patella and it is located deep to the quadriceps tendon. So this is known as the suprapatellar bursae. Actually, this suprapatellar bursae is continuing with the joint cavity. So remember that the suprapatellar bursae is an extension of the joint cavity and superiorly it is located behind the tendon of the quadriceps femoris. So effusion in the knee joint will distend this bursae, which is described as water on the knee. So as it is continuous with the joint cavity, effusion in the knee can spread to this region. So this one is important, which is a deeper bursae. It is known as suprapatellar bursae. This is actually an extension of the joint cavity superiorly behind the tendon of quadriceps femoris. So it is communicating with the joint cavity. This is known as suprapatellar bursae. So another one is located below the patella, between deep to the ligamentum patellae, that is known as deep infrapatellar bursae. So deep infrapatellar bursae. So these are the bursae which are anteriorly located. So two which are present. One which is present above the patella is suprapatellar. One which is located in front of the patella is prepatellar. And there are two infrapatellar, that is subcutaneous infrapatellar and deep infrapatellar. So now we look at the lateral group of bursae. So before discussing the lateral group of bursae, we will see the lateral aspect of the knee joint. You can see the lower end of the femur. This is the upper end of the tibial condyle. You can see the head of the fibula here. So looking at the lateral aspect, we know that there is a fibrous capsule. This is the fibrous capsule of the knee joint. And you have a lateral ligament which is known as the fibular collateral ligament, which is attached like this. This is the fibular collateral ligament. So near the attachment of the fibular collateral ligament, there is a tension of muscle. Which is that muscle? There is a tension of the biceps femoris muscle here. And there is a intracapsular tension here. Which muscle? That is intracapsularly the tendon of popliteus runs very close to the fibrous capsule here. So this is the tendon of the popliteus, which is running like this, very close to the fibrous capsule of the knee joint. So actually this tendon of popliteus is separating the fibrous capsule from the lateral meniscus. You had learned it in the previous videos. So these are the structures here. So we will discuss the bursae one by one. So we can see that there is a bursae between the tendon of the biceps femoris and the fibular collateral ligament. So this bursae, which is located between these two, is known as, it is between the tendon of biceps femoris and fibular collateral ligament. This is the bursae between. So and there is another bursae which is located between the tendon of the popliteus and the fibular collateral ligament. So that's the bursae that is known as bursae between the tendon of popliteus and fibular collateral ligament. So and there is a bursae between the tendon of the popliteus and the lateral condyle of the tibia. So that is between the tendon of popliteus and lateral condyle of tibia. This actually communicates with the joint cavity. So and posteriorly you have another muscle which is located posterolaterally across the knee joint. Which is that muscle? That is the lateral head of gastrocnemius. So if you look posteriorly, you can see that you can see another muscle here, that is the lateral head of the gastrocnemius, is like this. So the between the lateral head of the gastrocnemius and the joint capsule, there is also another bursae. So that is between. So these are the important bursae, that is a lateral group of bursae. One which is located between the tendon of biceps femoris and the FCL, that is fibulocollateral ligament, and another one which is located between the tendon of popliteus and the fibular collateral ligament, and another one which is located between the tendon of popliteus and lateral condyle of tibia. And posteriorly you have a bursae between the lateral head of gastrocnemius and the capsule of the knee joint. So these are the lateral group of bursae. Now we'll look at the medial group of bursae. So we are going to discuss about the medial group of bursae here. So I have drawn the medial epicondyle, the medial condyle of the tibia here. We will discuss the capsule here. So this is the fibrous capsule of the knee joint, and closely attached to the fibrous capsule you have a medial meniscus, and the ligament which is present here, that is the medial ligament, that is known as the tibial collateral ligament. We know that the tibial collateral ligament has got a deeper part which is merging with the fibrous capsule and the medial meniscus like this, and it has got a superficial part which gets attached into the medial surface of the tibia like this. So and you know that the superficial part of the, so what you see here, this is the fibrous capsule, and this one was the tibial collateral ligament, TCL. So the superficial part of the tibial collateral ligament is related to three muscles here. One is a muscle from the anterior compartment, that is the sartorius. So this is the sartorius, and one is a so this is the sartorius, Other is a muscle of medial compartment, which is so three muscles which are attached to the medial surface of the tibia are related to the superficial part of the tibial collateral ligament. So other muscle which is from the medial compartment is the gracilis muscle, and other muscle which is a muscle of the posterior compartment. This belongs to the hamstring muscle, that is a semitendinosus. And we know that the other muscle is the semimembranosus. Semimembranosus is attached to the posterior part of the medial condyle of the tibia. So it is related, it is deep to the semitendinosus, and it is attached to the posterior part of the medial condyle of tibia. So this is known as semimembranosus. So now we'll discuss the bursae here. That is the medial group of bursae. So there is a bursae between the tibial collateral ligament and the tendon of sartorius, gracilis, semimembranosus. Actually, the tendon of these three muscles are inserted into the medial surface of the tibia. So there is a bursae between the tibial collateral ligament and the tendon of sartorius, gracilis, and semimembranosus. So it is known as, this is known as bursae Anserine bursa. It is also called Anserine bursa. So the term pus anserinus is derived from the foot of the goose appearance of the insertion of these three tendons on the medial surface of the tibia. So because of the appearance of the insertion of these three muscles into the medial surface of the tibia, it is named so, that is pus anserinus. Actually, this bursa is a communication, it is having communication with the joint cavity. So it is a communicating bursa. So this is important. This is called anserine bursae, that is located between the tendon of sartorius, gracilis, semimembranosus and the tibial collateral ligament. That is bursa anserina or anserine bursae. That is a communicating bursae. And we can see that the semimembranosus is attached to the posterior part of the medial condyle of the tibia. So between the insertion of semimembranosus and the medial condyle of the tibia, there is also a bursae here, that is between semimembranosus and tibia, condyle of tibia, medial condyle of tibia. So that is another bursae, that is also a communicating bursae here, communicating bursae. So and between the superficial and deep part of the tibial collateral ligament, you have another bursae. So that is between superficial and deep part of TCL. So and posteriorly you have so if you look at the posterior aspect like this, on the medial aspect, which muscle is located posterior-medially, that is can see the medial head of gastrocnemius. Medial head of gastrocnemius is located posterior-medially. Gastrocnemius is located like this. So there is a bursae between the medial head of gastrocnemius and the fibrous capsule. That bursae is known by the name, that is Brodie's bursae. Brodie's bursae. So it is also communicating with the joint cavity. It is also a communicating one. So which are the communicating bursae? So far we have discussed about first one is a suprapatellar bursae, that is an anterior group of bursae, and the Brodie's bursae between the medial head of gastrocnemius and fibrous capsule, anserine bursa, and the bursae between the semimembranosus and medial condyle of the tibia. Totally 4 bursae are communicating with the joint cavity. So that is all about the bursae around the knee joint. Now we will discuss about the relations of the knee joint. So I have drawn the anterior part of the knee joint. So first we will discuss about the anterior relation of the knee joint. So first we are going to discuss about the anterior relation of the knee joint. So we can see that the patella is located here like this. So this is a patella. Inserted into the upper part of the patella, you have the quadriceps tendon like this. On the sides you have lateral and medial patellar reticuli like this. Here you can see the ligamentum patellae from the apex of the patella inserted into the tibial tuberosity. So all these structures are related anteriorly. Which are they? This one is a quadriceps tendon. So another structure is patella. Patella is related anteriorly. Now on the lower part it is related to the ligamentum patellae. So and if you look at this is the lateral aspect, this is the medial aspect. If you look at the lateral aspect, here you have anterolaterally it is related to the lateral patellar reticula, and anteromedially it is related to the medial patellar reticula. So these are the relations anteriorly, that is the patella, quadriceps tendon, ligamentum patellae, lateral and medial patellar reticula forms the anterolateral and anteromedial relation respectively. So we will discuss about the posterior relation. So here you can see the posterior aspect of the knee joint. See the fibula also. There's the fibula also. So this is the lateral aspect. This is a medial aspect. We know that the tendon of us on the medial aspect, the tendon of the semitendinosus passes like this, and it gets inserted into the medial surface of the tibia. It gets inserted into the medial surface of the tibia here, and deep to the semitendinosus. So this one is a semitendinosus. So deep to the semitendinosus we have another tendon that is attached to the posterior part of the medial condyle. So that is present deep to the semitendinosus. That is known as semimembranosus. And you have another muscle here that is known as, this is which muscle? That is the medial head of gastrocnemius. Medial head of gastrocnemius. So the tendon was like this, and you can see another one has here. You can see laterally you can see another tendon, that is another muscle like this. That is the biceps femoris muscle was attached to the tendon was attached to the head of fibula like this. And you have which muscle? So this was the gastrocnemius muscle. This was the gastrocnemius muscle. So and you have this is the medial head, and you have another one, that is the lateral head of gastrocnemius like this. And the tendon goes like this. So and you have another muscle which is close to the lateral head, that is known as the plantaris. So this is the plantaris. So this is the lateral head of gastrocnemius, and this is the plantaris. So we will look into the posterior relation. So we have just drawn the posterior aspect of the knee joint. We can see the medial and lateral head of gastrocnemius, the semitendinosus, semimembranosus tendon, and the long head of biceps femoris tendon here. So if you look into the posterior relation, exactly in the middle we have some vessels and now running here. That is we know that the popliteal artery is running here. So this is the posterior most structure. So at the posterior aspect of the relation, so we are discussing about the posterior relation here. So at the middle you have the popliteal artery, and the popliteal vein is crossing the artery from the lateral to the medial side like this. So and crossing the vein you have another nerve, that is the tibial nerve. From lateral to medial aspect, the tibial nerve is also crossing the vein and the artery. So which are the structures which are located in the middle that forms the posterior relation, that is popliteal artery, popliteal vein and the tibial nerve. So we'll look into the posterior-lateral relation. So which is the posterior-lateral relation? It is formed by laterally you can see the lateral head of gastrocnemius, and you can see the one more nerve is present here, that is the common peroneal nerve, which runs from the superior to the lateral aspect of the joint like this. So that one was the common peroneal nerve. So common peroneal nerve, the lateral head of the gastrocnemius, and one more thing, that is the plantaris. The plantaris is also running from the lateral, running on the lateral side. So the lateral relation is formed by, posterior lateral relation is formed by lateral head of gastrocnemius. So the lateral head of gastrocnemius and the common peroneal nerve forms the posterior lateral relation. We know that the tendon of popliteus passes from the lateral aspect towards the medial aspect like this. So the tendon of popliteus also forms the posterior lateral relation. And now what is the posterior medial relation? So posterior medial relation is formed by, so look at the posterolateral structure, posteromedial relation. You can see the medial head of gastrocnemius. You can see the tendon of semitendinosus, semimembranosus, and also another muscle is attached here, that is gracilis. So these structures form the posteromedial relation. So, and we know that the popliteus gets inserted on the medial aspect of the tibia here. So, popliteus, insertion of the popliteus also forms a posteromedial relation, whereas the tendon of the popliteus from its origin forms a posterolateral relation. So to discuss the medial and lateral relation, we will use this diagram. So this is the medial aspect. Here you can see the superficial and deep part of the tibial collateral ligament. So this is the lateral aspect. Here you can see the fibular collateral ligament. So we know that related to the superficial part of the tibial collateral ligament, we have tendon of three muscles, that is sartorius, gracilis and the semitendinosus. And another one, that is the semimembranosus, also deep to this, and semimembranosus also. And on the lateral aspect you have which muscle? That is the tendon of the biceps femoris. The biceps femoris tendon is located here, and you have which muscle? That is the biceps femoris muscle on the lateral aspect. So one vein which is present on the medial aspect is the great saphenous vein. And how is the origin of this popliteus related here? We know that the tendon of the popliteus is from the lateral epicondyle of the femur. It runs like this, it passes intracapsularly, and the main muscle goes like this, inserted into the medial aspect. So the tendon of origin of the popliteus is also forming the lateral relation. So which are the medial relation? Medial relation is formed by these four tendons, that is sartorius, gracilis, semitendinosus, and you have semimembranosus. So these are the medial relation. And which is the lateral relation? That is the biceps femoris and this one, that is the tendon of popliteus, forms the lateral relation. And medially you have a vein which is the great saphenous vein also. So that is about the relations of the knee joint. So we have discussed about the anterior relation, posterior medial relation, posterior lateral relation, the medial and lateral relation of the knee joint. So in the fourth part of the video, we will be discussing about the nerve supply, blood supply and actions. So if you are going to draw the cross section of the knee joint, how will it look like? We will draw that also. So you can see the transverse section through the left knee joint showing its relations. So we will start with the relation. Before that, this is the upper surface of the tibial condyle, in which you can see the circular lateral meniscus and the semicircular, that is, or a crescent shaped medial meniscus here. Joining the anterior horns of the two menisci, you can see the transverse ligament, and you can see at the anterior most aspect, anterior relation is formed by the ligamentum patellae here. And on the anterior aspect you have a ligament, that is the cruciate ligament here. On the posterior aspect you have cruciate ligament. So this is the anterior cruciate ligament, this is the posterior cruciate ligament. So we'll label that. So we'll draw the two ligaments here. One which is located medially, that is known as, that is merging with the capsule of the knee joint, is the tibial collateral ligament. One which is located here, this is the fibular collateral ligament. So we'll label that. So intervening between the fibular collateral ligament and the capsule of the knee joint, we have a tendon of popliteus. So this is the tendon of popliteus, which is located laterally between the fibular collateral ligament and the capsule of the knee joint. So this is tendon of popliteus. So now we'll look at the muscle one by one. So we'll look at the posteromedial side. First we are having a muscle which is inserted into the medial aspect of tibia. Which are they? These are the sartorius muscle. So this is the sartorius. Another one is a muscle of medial compartment attached to the medial surface of tibia, that is the gracilis. Another one is the semitendinosus, and deep to the semitendinosus we have the semimembranosus. So these form the posteromedial relations here. And you have another muscle which is, sorry, we will label these three first. So, and we look at the lateral side. On the lateralmost aspect you have which muscle here? On the lateralmost aspect, with these muscles form the lateral relation, so which is attached to the head of fibula. So this muscle is the biceps femoris muscle. So this is the biceps femoris muscle. So now we look at the posterior relation. That is, there are two muscles here, that is the medial head and lateral head of the gastrocnemius here. So you have posteriorly the lateral head of gastrocnemius, and here you have the medial head of gastrocnemius. So these two are the two heads of the gastrocnemius muscle. And closely in relation to the lateral head you have the plantaris also. So it's the plantaris also. So we'll label that. Now here you can see the popliteal fossa, in which we have the deepest structure, that is the popliteal artery, and one lateral to the popliteal artery we have the popliteal vein. So and the most superficial one is the tibial nerve. So popliteal artery, popliteal vein, and the tibial nerve runs here. So and we have another nerve, that is the common peroneal nerve. It is located slightly laterally. So this one is the common peroneal nerve. So these are all the structures which are related to the knee joint. Anteriorly ligamentum patellae. You can see the anterior and posterior cruciate, which is intracapsular, and you have, so the tendon of popliteus is also intracapsular here. And you can see the medial group of muscles here: sartorius, gracilis, semimembranosus, semitendinosus. And we have on the posterior lateral and posterior medial aspect you have medial lateral head of the gastrocnemius, and except at the center of the posterior aspect you have popliteal artery, popliteal vein, and the tibial nerve here. And the lateral aspect you can see the biceps femoris also, can see the common peroneal nerve also. And the intracapsular one is the tendon of the popliteus. So if you learn the relations, it will be easy to draw the cross section. So thank you for watching this video. To see more videos on my channel, please subscribe the channel. Thank you.